Let's do it.
Let's do it. All right. So I'm Tanya Baldwin. I am Divine Healing Priestess. And the reason why I chose that moniker was a little bit from the people that follow me, but also, we are all divine healers. It's all of us that do the healing. And I say this as a nurse of over 20 years, that it's you that's the healer, not me in any way. I just guide you. That's all I do. And that's what priestess does is guide. So today I want to talk about something that's like really, really that I'm super passionate about, and that's trauma. And that's because I've spent a lifetime with my own. And then I decided to branch out and help other people once I had healed my own trauma. Because healing is absolutely possible. We do not need to, seek therapy for the rest of our lives. We do not need to take pills for the rest of our lives. We do not need to, succumb to that. We have this trauma story. So what I've done in my healing, besides coming out and helping other people with trauma, is that I decided that there was a little bit of a gap. We keep hearing this buzzword of trauma informed. Well, information's great, but what do you do with that information? So I decided I wanted people to be trauma aware. I wanted to give them awareness, which to me is the combination of the information plus practical usable skills. And that's where I love it. I love teaching it to not just, my clients, but also to other healers. So many programs out there nowadays, like you can take an NLP course, or you can take all of these other, modalities. You can become Reiki certified, but are they teaching you about trauma and what to do when you encounter a client that has trauma? And, I found that in one of the courses that I took, which was on quantum healing, the gentleman that taught me ended up having me come back and teach everybody a trauma awareness component. And that's because you'd get out there and people would be like coming to see you saying, I just would like to see a hypnotist to remove some weight because I've just had this problem with weight. Not realizing that weight is just a symptom, can be a very big symptom of trauma for a variety of different reasons. So they would end up having this training in this modality with no understanding of trauma and what to do about it, and then think that they're just talking with their client for weight and find out, wait a second, it's not just weight. There's a whole underlying trauma here. So that's what I'm going to give you is some information and some practical tools to use for you and somebody that you're working with, or just you and your family members, even somebody that you encounter in public could use any of these techniques. So what is trauma? Anyone can comment on what they think trauma is, or what they determine what their definition is. There's so many variety of definitions for trauma, but what I like to think of as trauma is what we're left with when we're overwhelmed beyond what we can cope. So if I'm, and that's why it's so different for everybody, because Jamie might have techniques or her resiliency level might be different than mine going into an experience. And to her, it might not be very traumatizing, but for me, because I'm overwhelmed already and my ability to cope is very low, then that's going to be a very overwhelming, very traumatic experience. Some of it's based in how did we grow up? So for me, I had an enormous childhood trauma, starting, pre-birth, because my mom was an abused woman and was abused while I was being gestated. So I got flooded with cortisol and adrenaline while I was in utero. And my birth was traumatic, and since then. So my parents didn't teach me, this is how you acknowledge or validate your emotions. This is how you soothe your nervous system. This is how you regulate. They didn't teach me any of that. So I would think, I'm really resilient because I've had all these traumas, and look at me still trudging through life doing just fine. I'm good. I'm very resilient. But what I didn't realize is that when something came to me that was disarming or alarming, I didn't have any understanding of how to soothe those emotions or deal with that. So all of us go through the same thing when we do get into our reactions to a certain degree. They may vary in how they're expressed, but we all go through the same process. So a threat comes into your environment and your body says, can I fight it? No. Can I run from it? No. Can I Can I disassociate and it'll go away? Like if I play dead, will it leave me alone? No. Okay, well, what if I like do really nice things? Will it then just not eat me? So those are the kind of the questions that we ask ourselves. And initially we go into the automatic responses, which are fight and flight. Those are in the autonomic nervous system. They are an action state, like a really hyperactive state. So it pairs like your anxiety. When you're in an anxious state, your pulse is elevated, your respirations are elevated, your blood pressure's up, your temperature's up. All of those things are up, which is the same thing that we're dealing when we're in our threat response. So it really does pair with fight, flight, and anxiety in the same space. When we don't have those two that are available to us, either because we've determined that it's a bear, I can't fight it, it's a bear, I can't even outrun this thing. So then we go into our parasympathetic nervous system. So it dumps over, it's overwhelmed, we can't work on these. So we're going to go in here. So the first one is the freeze, which has a couple of subcategories. So freeze can be that you literally freeze in space and you're just like, done. I'm just going to stay here. And the other is that you flop. So you lose all tonic control of your muscles and you just flop, similar to fainting. But you may maintain consciousness when you flop because it's just your muscles that lose their ability. And then there's disassociation. And I like to call disassociation like the little helicopter man. It's where you jump out of the brain and into your little helicopter and you're piloting around back here somewhere, but you're not connected to your body. So we do that when we're under an extreme amount of information or extreme threat is coming at us and we can't comprehend it. Like think about, a child that's getting abused. They can't comprehend the abuse that they're experiencing. So they just separate from their body and disassociate. So their body they don't feel the full weight of the pain. The other one that we go into is fawn, and fawn is people pleasing, but it's that extreme people pleasing where I don't care about my needs. I'm going to override my needs to make sure that your needs are met, because if I'm taking care of you, then maybe you won't hurt me. And that's the premise of that. So when we go through those, if you think about an animal, the animals do the same thing. So if it was two dogs that came across each other, they would look, can I fight this other dog? No. Can I outrun him? No. Okay, maybe he's caught me. I'm going to play dead and he will leave me alone because I'm not palatable, or he'll turn his back to make sure no one else is going to take me, and he'll run and I can run off. I'll give him that. I'll get that opportunity. And then if not, then can I befriend the threat that's coming at me and, somehow survive in that way? So that's how we deal with the threats that come at us, is in one of those four formats. Now, because we are so much more advanced with our logic center, we also can be trained to work in different ones. So it might be my normal to go to fight mode. It might just be what my genetics makes me do, is that when I get triggered, something comes at me, my first thought is, I'm going to kick your butt. But then I could have been very early on thinking that, and my dad was like, oh yeah, you and whose army? And I went, okay, fighting doesn't work anymore. I'm just going to run because maybe I can run. And, maybe that was something that was really handy for me, running away from the threat that came into my world. But maybe it didn't. Maybe I was going to go to flight after fight, and my dad went, but I don't like to chase you. Chasing makes me even angrier. So I'm like, okay, wait a second. Fight didn't work because you're bigger than me. And flight doesn't work because that just makes you angry because you had to chase me. So then my default becomes disassociation. And I just disassociate from everything because I can't outrun it and I can't fight it. So I'm just going to always go to disassociation. Or I'm going to always go to people pleasing, because I found that by making sure that your needs are met meant that you're not going to give me trouble so bad. So that's how it can get really complicated in how you go. But it's typically you have your set. I go to fight and I go to fawn, or I go to flight and I go to disassociate. Those are my two natural spaces that I go in. Or you can be cultured into it through other exposures. Think about being an older sibling. And, when you were an older sibling and fighting your dad, maybe fighting your dad was okay, but you're seeing your younger sibling now be the target. So you become defensive. And instead of, I went into disassociate for myself, but now I realize I want to protect you. So I'm going to actually put myself in harm's way and go into fight mode again. So we do all of these different things depending on the situation that we're in, even though we have our normal patterns that we typically fall into. But what does that all mean? Great, we've been traumatized, or great, we've been threatened, and now we've got all these different things that are going on in our body. Well, when we get threatened into fight or flight, which can happen for anything, your boss can call you to your office, and all of a sudden you're like, "Oh, I'm getting fired. This is bad. This is bad," and our system gets triggered in that state as well. And we see our boss, and he's standing in what is known as a patriarchal position. So we're feeling the same as we would have felt when our dad reacted in that way. So we're right back to being that 3-year-old kid that dad's yelling at in our trauma response, even though we're really not in harm's way. We've just been called to the boss's office. But we're going to respond through the lens that we've created through our life. And because we haven't learned to soothe or regulate our nervous system, we don't even realize half the time that we're in a dysregulated state. And the problem with it is that as we're going through all of these traumas, we're getting cortisol, and we're getting cortisol, and we're getting cortisol. Well, what happens, the same as when you're in a loud environment and a train's going by every night, well, eventually you don't hear the train anymore. Someone new can come into your house and be like, "Doesn't that train like keep you up at night?" And you're like, "What train?" Well, the same thing with cortisol. You're like, "What stress?" Because your cortisol level's up here, but you've been stressed out this whole time. You just don't know that you're in your fight or flight or chronic stress. And that's how we end up in these inflammatory states and with autoimmune disorders, which I know a lot about because that's what happened to me. I didn't realize I was in chronic fight flight my whole life, that I was in these chronic stress responses. So I didn't know it until something big happened. So that's typically what happens for everybody. They're running along in their normal day-to-day, stressed to the max, not realizing that they're sitting here, and then something big will happen. They'll lose a job, and that's when the cortisol finally spikes above what the normal has become. And they'll be like, "Oh man, I am super stressed out now." Well, no, you've been stressed out all along. You just don't notice it in your system anymore because you become accustomed to it. So these are some of the things that is why it's so hard if I have a client coming in, for me to sit there and go, "Oh, that person has chronic stress and they're dealing with, underlying trauma." Because we've masked it for so long, we become so used to it that we don't even identify with it in our own bodies. So that's why having understanding and information is really, really handy for us. It's important to understand that what may be traumatic to you may not be traumatic to somebody else, and that's based on your ability to cope. It's also important to know that many people don't recognize that they have trauma because they think that was just life, or they think that how I did, where I was the director of nursing, the member of senior management, helping run a hospital and long-term care. Look at me, la-di-da, with my big title and my salary and my kids and my home. I'm a success by society's manner. There's no possibility that I didn't deal with my trauma. How did I get here if I didn't deal with my trauma?
Yeah.
Well, I got there because of my trauma. So the one thing that we oftentimes don't realize is how absolutely motivating.
Hey, Jordan.
Hi, Jordan.
Hey, hear me?
Yeah, we can hear you.
Hello.
Okay, I finally was able to come into one. So, all right.
Yay.
All right. We were just talking about trauma response.
Yeah, we were in the trauma response, about how we respond to our traumas, and that many of us don't even recognize that we have trauma because we look at ourselves in comparison to everybody else in society, which I'd hazard a guess that most of us in society have some form of trauma that we've not resolved, ongoing as well. But we look at it and we're like, "Oh, that would happen to everybody. That's just stuff that happened to everybody," or "That was just my life. That was just normal. That's no big deal." Or "Look at me now. I have a title. I have a job. I have a house. I have a partner. I have these things. So I must have done okay by my trauma." That's where I was at anyway, until my health started to fail. And I realized, oh, wait a minute, I didn't resolve anything. And I became very obsessed with learning more about trauma. I wanted to find out everything there was about it. No different than somebody, you know, when I got diagnosed with multiple sclerosis, I was like, okay, well, let's learn about multiple sclerosis, because if I've got this, I want to know all about it. So I did the same thing with my trauma. And I was talking about how we have typically 4 different responses that we go into. They can be different depending on your previous exposures and what happened when you used them before. Maybe you've been cultured by your parent to not go into that flight mode because that was just not okay in your home. Either way, we have what are our common ones, and it's important to know what your common response is. And sometimes we can figure that out, because I'll talk a little bit more about some of the behaviors of these particular responses. So I have a guide. I'm going to be giving you guys a guide as well that has all of this stuff written out in it, so that you can reflect on it as well. So when we get traumatized, or when we get triggered, the hormones and chemicals that flood our system take about 20 minutes for them to go through. So whenever you get triggered, give yourself at least that 20 minutes to say, okay, I'm in my flight response. I'm whatever, I'm disassociating. I'm going to do my breathing. I'm going to, go to whatever resiliency tools that you have. And I'm going to do this. And I'm going to give myself 20 minutes to really let everything flow out of my system. So when we go into fight mode, fight doesn't just mean that I'm going to physically hurt somebody. When we go into fighting can also be resistance, like pushing against, as opposed to fighting outwardly. Just like flight can involve running away, but it can also involve pushing someone away from you, whether that's physically or verbally, right? Somebody that's, I'm out, that's like flight mode, even though they're not physically running, but just the statement of I'm checking out, I'm done, I'm done, right? That's I'm closing, I'm fleeing the situation, I'm done, I can't take it anymore. When we go into freeze or disassociate, which is the similar to shutting down or turning off, it can also be just a temporary opportunity for us to take time to think, right? We go into that state of stasis, and then that gives us an opportunity to think what would be the best reaction here, or what is my where can I go to safety? Because that's what we're looking for, is how can we get to a safe space? And fun, that part of appeasing, right? It's just about appeasing but we get into it so much that we're just people pleasing all day long, every day, because we don't know how to say no anymore. We don't know how to put boundaries up anymore, because we've just been giving ourselves up for so long. So some of these trauma things happening when you're a child will create attachment disorders as well. So then we end up being either avoidant attached, anxious attached, disorganized, or if we're really lucky, safe and secure. But trauma is not going to give you that. Trauma is definitely not going to give you safe and secure attachment. So when we get consistently, our needs are consistently not met, we end up with an avoidant attachment. When we have inconsistencies where they're met sometimes, but not met other times, then we get that anxious attachment. And when it's wildly disproportionate on all over the place, that's when we end up with the disorganized. Mm-hmm. Avoidant is that we just, because our needs haven't been met, you're like the lone wolf. You're like, well, nobody was there for me anyway, so I guess I just got to go through this life on my own. So the minute that there's a problem, I'm out. I'm out. You're not going to be there for me. You're not going to help me. You're not going to support me. So I might as well just go on my own. And, they're more willing to just jump out the door. With someone that has anxious attachment, they cling on and pull you to them because they had those parents that would come and be very loving, and then other moments be neglectful. And they're like, but wait, I love you when you're loving, but why do you got to go away and leave me in this hurt state? So you cling on to them, don't leave me, don't leave me. And that's what we do within the relationship when that avoidant, which we typically partner the avoidant and anxious, the avoidant goes, I'm out, and the anxious person goes, no, you're not, you can't leave me, and pulls them back again. So we have these dynamics that come into play as well. So that gets trained through us when we're going through our early childhood traumas. And the earlier the traumas, the more likelihood that we end up with an attachment disorder as well. But all of this is curable. It really, really, really is. So we're going to talk about some of these, some of the stuff that happens within fight or flight. And I'm going to actually refer to my notes a little bit on this, but when we have fight mode, so when we go into our fight mode, when our childhood resulted in a home where you were not provided with healthy boundaries, you were given whatever you want, you were shamed, and or your parents bullied you or treated you with disgust or demonstrated narcissistic rage, the fight response tends to be your dominant response. And the unconscious belief that maintaining power and control will lead to love, acceptance, and safety. So fight can involve physical or verbal aggression, and it also involves any action that allows you to stand up, negate a threat. So this could be making a public media post telling everyone that someone hurt you. That is fighting on social media. That's that attack outwards. Yelling at someone when they shared something accidentally that you wanted them to keep privately. Spreading lies or rumors about someone who criticized you. Refusing to speak to someone after they did something like lose your sunglasses. So when we look at attachment types, those who tend to react to threats in fight mode often tend towards avoidant or ambivalent attachment types. And those who always respond in fight mode can hint towards narcissistic defenses. And that's not the full narcissistic personality disorder. That is an entirely different breed of its own. And we hear narcissism being thrown around a lot lately. And I try not to use that too lightly because there is a full-on disorder. But there are a lot of us have narcissistic tendencies. And anybody that seems to be super confident is immediately considered to be, oh, they're narcissistic. So just be careful when you're using the term as well. Flight mode. So when your parents or caregivers are unkind or abusive and you found that you could escape by dodging their actions, leaving the area or running away, you end up with flight mode. So the result is behaviors that allow you to escape or deny pain, emotional turmoil, or other stressors. So escape could mean staying longer at school with friends, wandering around the neighborhood, or running away from home, throwing yourself into your studies, creating plans to escape, and drowning things out with music. Flight can involve fleeing challenging or difficult situations, but can also result in perfectionism, so no one can criticize or challenge you. Ending relationships when you are threatened so that the other person can't break up with you. Avoiding conflict or painfully emotional situations. Workaholic, busyholic, or using alcohol or substances that fend off feelings of fear, panic, or anxiety. For freeze, so when you experience erratic treatment and not knowing whether today will result in abuse, neglect, or feeling overwhelmed by situations, you may use the freeze response as a stall tactic. You pause on an action while assessing, watching, and waiting until you determine which mode might assist you better, fight or flight. However, if you determine that neither will get you to safety, you might disassociate or flop in response. That involves shutting down temporarily by disassociating from your body or fainting. During disassociation, you feel removed from the situation, failing to remember accurately afterwards. If you flop, go tonic, or limp, the individual abusing you may use less force, resulting in less injuries, or they may lose interest. Similar to playing dead when a bear approaches, hoping it will not attack you because you are considered to be unpalatable. So long-term freeze responses represent a mask that you use to protect yourself from threats. You may go into your mind and fantasize or imagine escaping the distress. You may prefer solitude and avoid close relationships, hide emotions, physically detach from the outside world, sleep excessively, stay in your house or room, and mentally check out from distressing situations. And then finally, fawn responds. So as children, we may learn an alternative response that keeps us safe, and that is pleasing or appeasing the person who is threatening us. So you may ignore your own needs to take care of someone else, making yourself as useful and helpful as possible. Neglect or fail to develop your own self-identity, offer praise and admiration to your abuser. This can be generated out of relationships with narcissistic parents or one whose behaviors couldn't be predicted. In adulthood, you have a people-pleasing character or are involved in codependent relationships. So you might find yourself in also agreeing to whatever your partner wants, even when you dislike it or would prefer not to. Constantly praise people in authority who have power over you so you do not get criticized. Not really have a good sense of what you like or dislike. Avoid sharing your thoughts or feelings out of fear of retaliation or anger, and have few boundaries, if any, around your need. And whenever I describe the fawn, I always think of Runaway Bride with Richard Gere and Julia Roberts. And how when he goes around and he asks all her boyfriends, how does she like her eggs? And they're like, she likes them the way that I like them. It's her favorite way of liking the eggs. And it's because she actually doesn't know, because she's totally people-pleasing, codependent in her relationships. And it's like, she's never developed a sense of self enough to say, I actually like my eggs over easy or whatever. So she's just picking up whatever everybody else is doing because that's her way to acceptance. I'm being accepted because nobody's going to reject me because I like the same things that you do. We all like the same things. We all love the same things. I love doing what you love. So that's
it's about pleasing that other person, because when that other person is pleased, then your world is okay.
Yep.
I identify with both flight. The flight response mostly, like it's like it would in my childhood, in my trauma and experiences that I had, it was like I had to leave. I had to get out of here. I gotta focus on something else. And, so I was very like, gotta get out of this situation. And I would get on my horse and ride for hours and, be in the woods and just be completely alone with my horse. But that's very much like how, my response was. And you're absolutely right. When I got to the point where I was an adult and in a bad relationship, I didn't realize how stressed I was. And I didn't realize until there was certain things that were starting to come to the surface. At one point, my mom mentioned something and I just looked at her and I'm like, oh, that's normal. And then those words coming out of my mouth of that's normal made me realize that that's not normal. It was not normal, but it was my normal. And so I didn't realize how numb I was or desensitized to it I was, or how much I just carried it until, little pieces of information like that dropped into me, those little seeds of this isn't normal, this isn't right, Another one was when I was dealing with my shoulder pain and I'd gone to a chiropractor for years. And finally, I was like, what's up? What's the deal, doc? I mean, thousands of dollars, years of treatment, same process, am I going to get any better? And he just kind of tapped me on the shoulder. He's like, well, you're not going to heal until you let go of the stress you're carrying. And I'm like, what are you talking about? So this is my problem? Like, are you blaming me for your poor chiropractic care?
Why would you suggest that I'm carrying any stress around?
Right? And I'm like, I'm not stressed. But you like you said, it's your normal, it was my normal. And it's not normal. But I think that you're dead on in, identifying those things, because it is we do need to have awareness in people and seeing how they're carrying those things, that carrying that trauma response, because I mean, we all are exposed to trauma. We go through it, it's a matter of our resilience through it,
Yeah. So how can you widen that window, right? Yeah. Well, that's learning those soothing techniques. So, and trauma doesn't typically, so I like to, when I'm going through the trauma thing, I like to talk about, like if you were in a car accident, I used to, the importance of me as the practitioner or as the provider having my nervous system regulated, and how absolutely integral that is to anyone that you come across. Yeah. So I'll do it in the example of a first responder. So there's a car accident and the guy's on the side of the road and the first responder comes up and he's like, oh my God, buddy, you lost your leg. Like, wow, don't worry. We're going to get some other people in here. We're going to help you. And then just in a jiffy. And wow, I can't believe you survived that accident. That's like, wow. That guy is going to be so traumatized because you're not in control of your thing. But we learn, and or at least we should. And I don't know how many first responders learn, but You should. It should be a part of their education, just like it should be a part of anybody's education who has the ability to be interacting with somebody that has trauma and open up wounds. So anyone that's doing something like hypnotherapy or any of these new coaching programs, if you don't understand trauma, then you run the risk of significantly harming somebody through re-traumatizing them. So you need to be in control of yourself first, and you need to know what your resiliency is. If you can't handle listening to somebody all of a sudden open up about sexual abuse, then doing a hypnotherapy session with somebody who comes to you for weight might not be a good idea. Because a lot of women who have a history of sexual assault put weight on for a multitude of reasons, one being protection. And I did it. When I went through my trauma and recovery, I lost 80 pounds, and I lost it easily, and I've kept it off with ease. I don't follow any diet program. I think I just ate a half a watermelon before we start this. I love my watermelon, but anyway, it's because it's a buffer. It's a protective thing. It doesn't just put physical space between you, the weight that you have on you. In my mind, I had all these unwanted advances as a child growing up. The number of sexual assaults that I suffered was just ridiculous. So, and I was also kidnapped twice. So for me, it was just, if I wear this weight around myself, then nobody wants to kidnap a chubby chick, is basically what the message was in my mind. Nobody's going to want to come on to me because I'm not attractive. So why would anyone want that? Dress in colors that would fade into the background. Don't do makeup. Don't worry about your physical appearance outwardly. So people do that as a protective mechanism, and they don't even oftentimes realize that that's what it's for. So they think that their life was normal. They think that, maybe they've repressed their memories of Uncle Bad Touch. So they've got weight with no recollection of why, because they've repressed those memories, and they come in thinking I've been trying to lose weight for years and I just can't get it. I've tried all the yo-yo diets and I've done this and I've done that. And then all of a sudden you do a hypnotherapist session with them, and they break wide open. They start seeing these images and start talking about that. If that's not something that you can handle, then you need to really question, being in that environment and going through that. Because that exposure right there, it could be enough to just ruin that person. Mm-hmm. So when we're doing that, when the person comes up, right, to the person that's on the ground, they're going to come in and they're going to be in control of their nervous system. And they're going to walk up and they're going to say, "Hi, buddy. I see that you've had an accident. I want you to keep your eyes on me. You're just going to keep focused on me. We've got some other people that are coming into the scene right now. We're going to get an IV started, and I don't want you to worry. What I want you to do first is to focus on your breath. Can you focus on your breath going into your chest nice and slowly for me? Okay, so now this first person on the scene, their name is Joe, and they're going to start an IV on the left side there, and you're just going to keep focused on me." That person's not going to be traumatized because I'm in control of my nervous system and I'm giving him something to regulate off of. And that's how you should be approaching the scene. And the same thing when we're working in an environment where it's not a physical trauma like a road accident, but another type of trauma that's coming towards us. So the body keeps the score. Bessel van der Kolk, I say it in the right direction would be even better. Who has dyslexia? I don't know. Bessel van der Kolk or Bessel Bander. Either way, but they keep the score. So about how trauma gets stored. So it's our emotions, our energy in motion, and that's what they're supposed to be, is in motion. But we don't allow them to process through and because we weren't taught most times to self-regulate or to regulate in any way. So we end up stuffing them down and storing them. And I talk with my clients, is one of my thing that I like to talk to them all about, is because they're like, it's overwhelming. If I have to open the doors, it's a whole floodgate of just traumas behind this dam. And it's yeah, because everything that comes in, you just push it down and push it down and push it down. And you've stuffed all this stuff in there. So it does feel like it's overwhelming because you've got emotions of, say, 30 years of unprocessed stuff sitting behind this dam that you've created. And the whole point is creating a safe space, a container, and allowing them to slowly open that up, not just opening up the floodgates and letting everything out.
Yeah.
Well, we learn to deal with our emotions at the moment. We don't even need to put a dam up. We just deal with them, feel them, heal them, and move on, right? So I like to say feel, deal, and heal, because you feel the emotions, you deal with what it brings up from you, and then you heal through it onto the other side. So
Good.
we'll talk about the trauma. So in my experience, trauma always finds a way of coming out. Whether it comes out through disease or illness, it comes out through substance abuse, numbing out. It comes out in long-term, like in our relationships, in our weight, in the way that we process like in our workplaces. All of those, it comes out in all these little ways, big ways, small ways. It doesn't, in so many ways. So most often, though, it results in that hybrid of fight, flight, and fawn. Flight, freeze, fawn, and fight. So the fighting and the fawning go together. The flighting and the freezing typically go together. And once you learn what your response is, then you can start to go to, well, what can I do to get out of that response type? So if I'm going to fight, normally, sometimes you can see in your client that they're hitting fight mode before they even get there, because they'll like tense their hand up. You'll see them clench their fist, or you'll start to see that they're grinding their teeth, and that muscle's just starting to flex, or you'll see the veins start to come up in their head, or tension along their neck. And you're like, or the temperature, even just seeing them getting flushed. And you can tell that they're rising into that response. The sooner that you catch the elevator going up, the least number of floors that you have to come back down, right? So that's the importance of catching the ride on the way up, as opposed to when it gets all the way to the top and you're blowing your top. So catching that ride so that you can bring it back down. Now, we can't just tell our heart, beat 20 beats a minute, or beat 80 beats a minute, or beat 120 beats. We can't tell it to do that and just have it miraculously start beating at a specific set number. Just like we can't tell our body temperature, hey, I want you to be at 37.6 right now. And it's just going, okay, let's do 37.6. But the one thing that we can control is our breath. Mm-hmm. The beauty about our breath is that when we take control of our breath, we also take control of our pulse, and we take control of our blood pressure, and we subsequently take control of our temperature. So where our breathing goes, our pulse flows. So it's a very important thing to keep in mind. So when we get into some of the things that we can do to regulate our nervous system, there's two ways that I like to capture it. One is restoring safety to your nervous system long-term, and the other is catching it in the moment. So what can you do to help yourself in the moment when you're dealing with something? So if we take that situation of long-term, how can we regulate it over time? It's about teaching your nervous system, what does safety feel like? And then implementing that consistently throughout your days and your weeks and your months. So the technique that I like to use for that is heart-focused breathing. And whether you're doing just regular heart-focused breathing, or you're doing the quick coherence technique, either one of those two are essential for recalibrating your nervous system. So you're bringing your heart and your brain into coherence. The Heart Math Institute studied this since the 1960s. We are heart-focused creatures. We're not brain-focused like we think we are. The electromagnetic field of the heart can be measured in about a 9-foot circumference around your body. And when you feel somebody, when you sense how, like when you get that feel, that vibe from somebody, it's from their heart. It's not their brain. When they measure the electromagnetic field from the brain, it's about 1 inch from the skull. So big heart, 9 feet, 1 inch, right? It's just that our brain's a narcissist and it named itself. So we think that it's the most important thing because, well, the way that it is. But we are heart focused. So doing the heart focused breathing allows us to get our brain and our heart into coherence. It regulates our nervous system. It heightens our immune function. It decreases our inflammation. It's amazing. Reduces stress, improves sleeping. There's so many things that this heart focused breathing does. You need to do it for a minimum of 3 minutes for you to have heightened healing for up to 6 hours. So for 3 minutes, get 6 hours worth of benefit from it. Amazing. So I train my clients to do it 3 times a day. I tell them to do it once in the morning, and I tell them to do it once before they go to bed, and then pick a time in the afternoon. Now, if you're a day worker, then maybe do it right before you come into your house. And why? Because then it's like a wash. You just washed off your screen from everything outside of the home environment before you come into the house. And I taught my son to do this because he's one of those, he has OCD, but it's obsessive cleaning disorder, not just that's where it is.
Send them our way.
It's just, so he would come home mad at like work, was stressed out and come in with all the energy of work. And then he'd see like a cloth, like just sitting on the side of the counter, and he'd be, oh, like people can't even pick up after themselves. Right. And it's like, well, maybe if you just did some breathing before you came in the house, then you come in the house and you see that and you'd be like, you know, like I wish they had to put it away where, you know, like I wish they had to like put it nicely over there instead. You wouldn't be bringing that energy, that energetic charge in with you. So whether it's before you come home after being at work, or if you're working evenings and it's before you leave your house to go to work in the evenings, whatever time it is, one point within the middle of the day that you're going to as well do it. Now, if I was a mean nurse, I'd make you do it like 8 hours. I just set the clock every 6 hours. You put yourself up in the middle of the night. Do That's the worst thing about being a nurse is, hello, it's 2 a.m. and you got a pill to receive now. I know you were doing that essential thing called sleep, which is really great for your healing, but get up. It's time for your med. All right. But if we can get to 3 times. So it's a really simple technique to do. That's the other part about it. Anybody can learn it. I've taught this to my nieces. It's the best thing. Like, you know, they've got their own little mechanisms for calming themselves down too, but teaching your little niece to breathe into her heart space, just the cutest little thing. But you can put your hands on your chest. Yes, they're in the center of my chest, but that's okay. This left hand is going right across my entire heart space anyway. But if we look at our energetic chakra system, that's going through the center of our body anyway. Where our focus goes, our energy flows. So that's why I have my hand here. It's just because I want the visualization of where I want to breathe. And in order to do the heart focus technique, we're just going to breathe in nice and deep and slow over 5-second inhale and 5-second exhale. This is the time that they found was the most common that people felt comfortable with, but you can change it to 4 seconds if you have any lung issues. You could extend it to 6 or 7 seconds if you want it to be really long and slow. But it's just simple, focusing on your breath coming in and out through here for a 5-second inhale and exhale. So we can start doing that first by exhaling. Now you can keep doing the breathing while I do the counting, and I'll talk a little bit more about it. So when we're doing this technique, we're just merely counting for 5 seconds in, counting for 5 seconds out with that nice deep inhale, exhale, focusing on the air coming in and out through our heart space. The way that we can add this to the quick coherence technique is to think of something that is in an energy renewing emotion. Emotions are not bad or good. They're not negative or positive. They're just an information system telling us something about our environment. But they do have certain characteristics about them, whereas anger is a depleting emotion. You get very tired when you're angry. And joy is an energy renewing emotion. If I just told you had an all expense paid trip to somewhere that you wanted to go most in the world, and all your bills were going to be paid for and your children were going to be taken care of, you'd get really joyful really quickly. And in that, you're going to get energized, right? So to change it to the quick coherence technique, all we do is just think about something that brings us the emotion that's energy renewing. So joy, care, appreciation, gratitude, calm, relax. Some of them have really big amounts of energy that they bring to you, like joy, whereas you think of something that makes you feel calm, you're not going to get a burst of energy, but you're not losing any energy either. So that's how they classify emotions in the HeartMath Institute, is they're just either energy depleting or energy renewing, but it's all an information system. Things that make you angry, they're valid. Your emotion to feel angry is valid. But what ends up really giving us trouble is our reaction to it. And our reaction typically comes out of the fact that we are storing all of these emotions and experiences from our previous experiences, and we haven't dealt with those. So now we're stuffing another one on top and another one on top and another one on top. Well, if I was a child and my dad would yell at me and then he would hit me, if my boss calls me into his office, he's already in that position of that patriarch. Well, if he starts yelling at me, what is my body going to think? My body immediately thinks this patriarchal person is going to hit me. So I'm going to start feeling like I did the first time that I felt this way, which could have been when I was 3 years old. Well, what do 3-year-olds like to do? They like to have temper tantrums, right? And have you seen adults having temper tantrums? That's why, because they're not actually an adult at that moment. At that moment, they've been triggered and they're back as that little 3-year-old where their dad, who's supposed to love them, yelled and screamed at them and then hit them and it hurt and they can't even make sense of it. And all they know is that it hurt and they just don't like feeling like this. Can somebody just make it stop? So when we see people responding disproportionate to what the experience really is saying that they should, right? If somebody, came up and, somebody got your order wrong, I mean, you're probably not flipping the table in the restaurant because they got your order wrong, unless you're used to people continually letting you down and they've let you down throughout your whole entire life. So now you're overreacting because you're reacting from that space from all that time ago, with every single time that they've done that stacked on top of it back to that first thing. So that's how we know that somebody has some trauma underlying it. So we can do the heart focus technique for ourselves, and we can do the quick coherence technique for ourselves, but we can do what's called a shift and lift technique. And that's where we do the heart focus technique and then we radiate that out to other people. So when you have a group program and you have multiple people in it, you can teach all the members of your group to do that. And I've done this with my clients before, and it's really amazing. Like I've had, we're having these profound group experiences where we are talking about topics as deep as sexual assault and having someone like being very emotional and raw within their story. And everybody in the group is doing heart-focused breathing and sending that beautiful, calm, loving energy to that one person and you can see it. You can see the way that their body changes and the body language, the way that their color changes. You can see that they can feel that radiating to them and calming them down. Another thing to do is give a couple of techniques that are really helpful for somebody that's dealing with trauma that will help in the moment. So that heart focus technique, great to give them to do throughout the day, 3 times a day for a minimum of 3 minutes. Try to do 5 if you can, in the morning, afternoon, and bedtime. You can use it, again, the shift and lift technique, so you can radiate it in a group towards somebody. If you were out for dinner and the one person is flipping the table because somebody got their order wrong, everybody at your table, good vibes to them. And then, sorry. No, come on, go away. Somebody calling me on Facebook Messenger at the same time. Decline. So the 2 other techniques that I really love to give people, and this is something that you can give to someone that they can take with them who has known trauma. So the one is dealing with anxiety, and if you get knocked out of the present moment in fear-based thinking, whether that's fear of something coming at you, fear of something that's already happened, and you're stuck in that mindset. So we want to ground into the present moment, and you can ground in a multitude of ways, but this is one technique that I love giving to people because it's so portable. I could be sitting in a business meeting doing this and nobody would even know it, keeping myself nice and calm. So you're just taking your thumb and rubbing it against your first 2 fingers, and you're just absorbing yourself in the sensation of touch. You feel your fingerprints. You can really focus on that sensation. So that's part 1. We're now grounded because we're focused on that sensation. Next, we're going to slow down our breathing. And I like to slow down my breathing with this and pair it with the next part of it. So I'm going to do the 2 pieces together, but slowing down our breathing, we know will help our heart rate, will help. Obviously, we're getting better respirations. It's going to lower our blood pressure. It's going to make sure that we get back into that rest and digest. But the other thing is taking control of the thoughts, because if the thoughts are still running around, I'm doing this and I'm trying to slow down my breathing, but my thoughts are still all blah, 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 that's just going to spike me back up again. I'm not really going to keep it in control. So let's take control of the thoughts too. So the one way to do that is this 2-question answer scenario. And I like to do it, like I said, with my breath. So when I inhale, I pause at the top and I say, where am I? And then I exhale. And when I get to the bottom of the exhale, I say here. Then I inhale. And when I get to the top, I say, what time is it? And then when I exhale and I get to the bottom, I say now. So where am I? Here. What time is it? Now. And you just keep repeating that as you inhale and exhale, nice and slow, focused on the feeling. I could be sitting in an office meeting, having my hands cupped on the table, all the while rubbing my fingers behind them. Nobody knows. Nobody really sees when you slow down your breathing. I can tell you that for a fact. In the number of board meetings I've been into doing good, they don't notice it. They don't notice it. You can do this. You can sit your hands on your lap underneath the boardroom table if you feel like they're going to notice it. There's so many ways that you can do this. You can even be driving your car and doing it with one hand while breathing through it. So I love it because it's portable, so people can use it anywhere. The second thing is for distress. So there's a bunch of different, one of the things I love finding is all these different ways to give people things to help soothe them and calm them down and, regulate their nervous system. But this one's really a great technique. It's out of the same space as EMDR, which is eye movement desensitization and reprocessing, which is a therapy technique that's used for people that have PTSD and complex PTSD with flashbacks and things like that. But a subsection of that is called brain spotting. And brain spotting is also with hypnotherapy. But it's a technique where you basically alleviate the emotional ties to memories. But this little portion of it, so the brain spotting technique uses this part of it, but that's it. That's the only part of it. So the whole part of it is rubbing your arms in a downward motion. So what this does is it drops your brain into delta waves. So delta waves are a slower wave pattern of your brain that is when you are calm and relaxed, and definitely in the rest and digest realm. So this simulates the soothing that you would have received from a caregiver as a baby if they picked you up and they were rocking you and rubbing your back. It brings that same feeling to your body. So you can do this to yourself to soothe yourself. And depending on the way that the person's trauma shows up, if they're fight, flight, freeze, disassociate, you could change some of the ways that they're going to process this. Somebody that, maybe has a high level of fight and flight that they want to go to, maybe they want to rock with it to give some motion to it, right? Moving back and forth or side to side just to give that extra little rocking. You're going to bring affirmations or positive statements in as well. So saying things like, I am safe, I am protected, I am lovable, I am worthy, whatever it is to override the experience that they're going through. When there's someone that disassociates a lot, the framing is something that can be really handy. So besides doing the arms in the downward fashion, putting the one hand under and the other hand over, it reaffirms your frame of your body. And then you can also rub down the one side of the arm with the other one. So doing that as well. And with the fawning or people pleasing, you could always, after you've done this for a little while, bring your hands back to you, right? Because you need to be the focus. So what do I need and how can I give the love to me? Right? So that's that focus there. So those are the things that I really like to share with my clients or with therapists so that they can share with their clients, and especially the heart focused breathing so that they can be in control of their nervous system and regulating it, which will then help the client that they're working with to regulate off of them as well, or anybody in your environment who's dealing with any trauma.
Yeah. Wow. That was amazing.
I could talk for so long on it. It's just like, whoa, slow down. Wait.
I know. Sometimes it's hard to slow the train down whenever you're just passionate about it, and you're clearly passionate about this. And, I never, I went the opposite way with my experience of trauma. for autoimmune diseases and issues of that, I went into the education of all of that. I need to understand that. But I went into a different way of just healing, doing that inner work and healing, but not necessarily like you did into the obsession of, not obsession, but the passion of trauma and understanding it. But clearly you're drawn to that and you're supposed to be doing that because you're a nurse and you've been, so this has been surrounding your whole life. But I don't think it's common that people want to go into that and are so, because they just rather check out.
Yep, absolutely. It's definitely a more challenging. I think when I thought of it from my aspect of it, that, like, oh, I had this autoimmune diagnosis. And then when I stopped to take care of the autoimmune diagnosis, my trauma went, oh, did you stop running from us? Hold on. We've got some stuff for you. And I was like, oh my God. So then all the other diagnoses came out and it was like, oh, great. And when you go the traditional route of here's your psychotherapist and here's your medications and, we'll just keep giving you more medications and whatever. And I wasn't healing. So, I thought, well, there's like, even with the MS, it's like, this isn't my diagnosis. This isn't my life. I'm not taking this on. I'm not accepting this. And, I kept thinking like, I've functioned so well for so long. Like now all of a sudden I'm like, done, like I can't work anymore, I'm going to be done. So I'm like, what got me through the first time was my high functioning anxiety. I like to say I just had high functioning trauma, and the high functioning trauma made me a real go-getter and made me very studious. And so I was like, it worked the first time, let's make it work for me this time. And I'm going to learn everything there is about these things and health and wellness, but from a different standpoint, which, I think they really do a disservice in nursing that they're not teaching this type of stuff, like how to actually heal. So,
and even that is almost a fight response until you're able to peel back those layers, because that was like, okay, I'm going to fight it. I'm going to fight this diagnosis. I'm going to fight, all of this. But that's that we talked about earlier about mining for gold. That was the gold that you were mining for, is that transformation, that healing. And now, you're a gifted healer, So it's pretty fantastic.
Yeah.
I
love it. I just keep learning more. So I started with following all the greats. So I was like, okay, who are the leading trauma experts? And I'm like, Gabor Mate, Peter Levine, Stephen Porges, like Pat Ogden. Like I just went out and I was like, okay, I'm going to read your book. I'm going to take your workshop. I'm going to learn your course. I'm going to do compassionate inquiry. I'm going to learn somatic experiencing. I'm going to learn all of these things. And I'm going to do it for myself. And I'm going to see what works for me and what doesn't. Well, maybe it'll work for somebody else, but we'll just put it to the side. So I kept doing all of that stuff while at the same time going on this holistic approach. So the diet, the exercise, what I was eating changed, the negativity cleanse of everything. Stop watching TV, stop playing video games, start getting outside more, grow my own food. Like I started doing all of that too. Then after I did the trauma stuff and I healed through that to a really good space, then I ended up hiring a Sharma and I'm like, teach me. And so I learned about yoga and pranayamas and mudras and mantras and diet again, but from the traditional, the sattvic diet. So I learned all of that. And then I was like, okay, well, what else is there? So then I started learning quantum healing and, delving into my spiritual gifts. And then when I learned the quantum regression therapy, that just blew the doors open to everything that I knew. It was just like, oh my God, this is like the best thing with everything that I've already got going to add to the mix. So that's what I do now. I have my slow program for people that want to do it in a little more of a traditional way, where we start establishing safety and then we work through with inner child healing and shadow work. And I'll even do a human design session with them. And I do a couple quantum sessions in that package. And then on the other side is just, you want to go in, you want to go hard, fast, get it all done, and we'll just blast it. 12 sessions of quantum healing back to back. So it's just whatever you're energetically bringing to the table in each session, we get to the root cause of it, remove it energetically across all 4 bodies and put it and it's just done. It's gone. It's dealt with. So those are what I'm doing. Those are what I'm doing now. Yeah.
Yeah, that's amazing. I got a question for you, and you may, this is kind of like off the wall here, but is there any studies or connections between like night terrors or really bad dreams consistently with trauma response and that type of a thing, even if they're not even associated with it, with the actual, like if you had experienced a car wreck, but yet your dreams are about, zombies. I don't know. I'm just saying,
Yeah.
even if they're not like the same experience of trauma, is there a connection scientifically or that you found in your practice that those night terrors, night dreams, bad dreams, connected?
And some people don't even get the dreams. I like to call them black mirrors, and that's my own way of capturing it. And that's what I experience. So I call it, it's all feeling, no picture. So you just wake up terrified and you've had what feels like a nightmare, but you don't have any recollection of it because the nightmare that I would be having would be on stuff that I had repressed. So I don't even know what I was nightmaring about, but I would feel the feelings and wake up absolutely terrified, like someone had violated me, and I just like nothing, no memory of it. So it is quite common that they can show up, that you're going to have nightmares. And our nightmares aren't typically, a lot of times, and I tell people about this all the time, when you're looking at your dreams and stuff, like you might be thinking, oh, I'm having this dream of death. Well, death, typically, if you're dreaming of death, there's something that's being born in your life. There's a birth of some sort that's going to happen, like a newness that's coming about. So sometimes the symbolism in the dream is what's going to lead you down the rabbit hole to figure out what exactly the dream is pertaining to. But there is a lot of, one of the biggest things with CPTSD, like whether it's PTSD or CPTSD, is nightmares, right? And flashbacks. And the nightmares don't have to make any sense. None at all.
Yeah.
Mm-hmm.
We have our family, we have several nieces and nephews, and even some of my children have just nightmares, like night terrors. I mean, my nephews specifically, they have night terrors, that are pretty all the way through their adulthood. My daughter struggles with weird dreams. She just has these, like, when you wake her up from a dream, it's just, she's like, you're just like, okay.
Yeah. She needs a dream walker is what she needs.
She needs a what?
A dream walker. So a dream walker is somebody that can walk into somebody else's dream and soothe them on the inside, which it's a really cool. Some of us have like when sometimes dreams are traveling, like we're actually traveling to somewhere else that we've been to, another time and space. So that can be really cool, like astral projection or lucid dreaming, things like that. So they can be terrifying too. I mean, depending on the age of the person that's experiencing it. But, and sometimes it's just garbage. But then there are a lot of times when our dreams are either re-experiencing or a symbolic experience of what we experienced before, just the way that our brain is processing it for us. When you're a child, you might not understand what sexual assault really is, right? You can't comprehend that. So your nightmare it's a nightmare where you're getting eaten by a bear.
Yeah.
It's just, that's the way that your brain could process it. I don't know what's going on here, but it's terrifying and it feels like I'm being eaten by a bear. I'd rather be eaten by a bear, but so your brain just concocts this. That's what it did to make sense of it.
Yeah, that makes sense. Interesting. Fascinating stuff, girl. I love it.
Me too. Anytime.
It's difficult to say that you love it because, I mean, it is a very painful, intimate place. Yes. But, to have the boldness to go into those deep places and to have the strength to go into those, to see there's so much beauty to have on the other side. There's so much freedom to have on the other side. And you're really a different person on that other side because you've truly been transformed. And it's a terrifying experience to go into those dark places. But when the transformation that is on the other side, it's worth it 100%, to go through those. And, and it feels, I don't know, revealing, poor, whatever you want to say to acknowledge that you've had trauma in your childhood or trauma in your past. But I feel like that's also something that we need to bring awareness that it's common. It doesn't mean that you're white trash. It doesn't mean that you're, from the ghetto. It means that you're human and
Yep.
you're having a human experience. And so many people have it. And it's just, and you can be of the richest homes and the richest environments and the most godly parents or spiritual parents and still have experienced these
Yep.
things.
Yeah,
And
it's not always planned, right? Like, and I always give my story, like, some parents were, they were really bad people, and some parents, they just made mistakes, and those mistakes ended up creating trauma for their children. I was a young mom. I had 2 kids by the time I was 20. And when I was a young mom, the current information that was going around was that you should let your children cry themselves to sleep.
yeah,
Well, imagine my surprise when I'm an adult learning all about how, trauma, and it was through my learning of trauma that I've, learned that they don't have the soothing mechanisms. They don't know how to self-soothe at that age.
yeah.
So anybody that let their kids fall asleep by crying themselves to sleep, traumatize them. Like that's what you created, because
But
they're
that's
trying to have their needs met. And you're not meeting their needs because you're like, yep, this is what the research is saying we should do to let our babies cry themselves to sleep. That's how they're going to learn. Right. And then after a while, your child's like, well, I just like, nobody's coming for me. Nobody's coming to meet my needs. Like, I'm hungry, I'm wet, I'm this, I'm that, right? There's a reason why I'm crying for attention. It's, and so I had to, at the end, I'm like, I didn't do it intentionally. I didn't get up in the morning and say, yeah, today this trauma's starting for these boys. Let's bring it. Right? I was doing my best every moment of the day to be a good mom to my boys. And at the end of their life, like at the end, I'm looking back and I'm like, yeah, that was trauma. Oh yeah, because I didn't resolve my trauma. I also traumatized you here. And, so there are all these ways, but it wasn't an intentional thing. Right. So there's a lot of unfortunate, loving, kind, amazing people who did the best that they could and still traumatized their children. And so we have to take some of that off of trauma, that it's not all, like somebody is like all Hansel and Gretel with their kids. You're in your little, here you are in your jail cell and I'm feeding you through the cracks, like, yeah, okay, we can understand that's trauma and that person's really, really bad. But there's so many subtle ways that it comes about, even just pervasive bullying, right?
Yeah.
Like we had a lot of bullying, like parents, family, uncles, whatever, and they would just tease and bug and stuff like that. And it's like, you can't carry a tune in a bucket, like make fun of your appearance, or they, like just stupid bullying stuff that, your parents and their family or their siblings would do. That creates trauma in us, right? Then we feel, like we go through our whole lives feeling shame because we're not accepted by our family, or we're not accepted by our peers. It's not like, even then, your uncle's sitting there going, you can't carry a tune in a bucket, like making a joke at you. He's not sitting there in his mind going, yeah, I'm going to traumatize that little girl. I'm going to set her up for a lifetime of issues. Yep, that's what I'm out for right now. Let's do this. Right? Like nobody.
We were like raised in the 80s, and well, I was raised in the 80s. Like, I think that was everybody's native tongue, was sarcasm and making fun of you. I mean, like mine was thunder thighs. Like, that's what everybody was, thunder thighs. And I had like this complex about my thighs, but it's innocent in a form, but we still deal with that. It's still, our body writes on our subconscious mind. We still carry it inside of us. And I think that that's the piece that we have to even give ourselves grace for, because we minimize, right? We minimize the things that are traumatizing in order to deal with them, in order to cope. So we minimize, oh, it's no big deal, it's just whatever, but when we do that, we're not acknowledging that or seeing that in us. Instead, we're just burying it, right? Just burying it in there. I used to basically just joke that it was kind of a joke, kind of serious, but it was like anytime something would happen that was traumatizing, I just buried that body in the backyard, put a nice, tombstone on there. And when someone would say they're sorry, even though they weren't really sorry, or they thought they were sorry, but they still continue to do that, it was like they were just going and laying flowers on that tombstone, and it was just like, nope, I don't need any more dead bodies in my backyard, and it's not until you realize how much there is back there that you've just buried and you've, held on to that is, really needs to be dug up, processed, healed from, so I really enjoy your workshop. I enjoy having you in this space. I'm excited about future workshops. And she's also going to be in our community too. So anybody who's interested in joining our community, for $35 a month, you get the tickets to all the health fair workshops, every one that we have, and all the replays into the community. And then you also have access to her and all of our other healers to go in there and just really just hit them up and say, hey, I watched your workshop on trauma awareness. I would like to speak to you. And all of our healers also offer something. And so you're going to find all of those free offers in the community as well. So it's been so good hearing your workshop and tapping into the tip of the iceberg of your knowledge and expertise. I can't wait to hear more.
So many things.
Right. But clearly you're passionate about this, and I know that whenever we first met, we just really hit it off. We're like, yes, you can heal. Yes. And yes, it's connected to emotional. So it's great whenever we find that like-minded person and just, build a community full of like-mindedness. So anyways, all right. Well, thank you so much. We'll see you. Thanks.
Bye.
Okay.
Thank you.
You're welcome, Joshua.